You're probably totally familiar with appendicitis, so we'll try to go quickly. All age groups can be affected, including pregnant women and even medical students. It's the most common reason for emergent abdominal surgery in children. In kids, it's often caused by lymphoid hyperplasia after a viral infection, and in adults, it's usually caused due to obstruction by a fecalith. The classic story is periumbilical pain that changes to localized pain at McBurney's point. Nausea and fever are common, and if it perforates before surgery, patients will develop peritonitis. Remember, though, that if you're suspecting appendicitis in a young female, your differential at the very least should include diverticulitis, which is more common in the elderly, and ectopic pregnancy, which of course is only worth checking in females, though if you found a case in a male, it would be a good case report. Remembering, though, that if you're suspecting appendicitis in a young female, you should at least check a beta HCG level to rule out the possibility of an ectopic pregnancy. Now we'll talk about the spectrum of diverticular diseases, from what exactly a diverticulum is to diverticulosis and diverticulitis. The definition of a diverticulum is a blind pouch protruding from the alimentary tract that communicates with the lumen of the gut. In other words, there's a pouch formed as if you pressed a finger from the inside of the gut outwards. You can see an image of diverticuli below. Most diverticuli are acquired, and most are found in the sigmoid colon. Another important definition is that of true versus false. True diverticuli include all three gut layers, whereas false diverticuli include only the mucosa and the submucosa, not the muscularis externa. Often these false diverticuli occur in places where the muscularis externa is thinned by perforation of the vasa recta. Diverticulosis, then, is a condition where the patient has many diverticuli. It's quite common, and due to an increase in intraluminal pressure along with focal weakness in the colonic wall. Patients generally have a low-fiber diet, and it occurs mostly in the sigmoid colon because at that point the stool is hardest after most water has been reabsorbed. The condition is usually asymptomatic, but it's a cause of lower GI bleeds. Often a patient with a single episode of lower GI bleed that spontaneously remits had bleeding from diverticulosis. Diverticulitis, lastly, is when a patient with diverticulosis has inflammation of one or more of the diverticuli. Classically, an older patient presents with left lower quadrant pain. Another rare complication is colovesical fistula formation, which can lead to pneumaturia, or the sensation of peeing out air. Antibiotics are the initial therapy. Zenker's diverticulum shares certain outpouching features, but it actually occurs in the esophagus, where the pharynx transitions to become the esophagus. It's a false diverticulum. A common and slightly disturbing symptom is halitosis, or bad breath, due to trapped food particles, but the major complaints are from dysphagia and obstruction. Whereas Zenker's is a false diverticulum, Meckel's is a true diverticulum, meaning it involves all layers of the gut wall. Meckel's has the classic rule of twos. The pouch is 2 inches long, occurs 2 feet proximal to the ileocecal valve, is found in 2% of the population, presents in the first 2 years of life, and may have one of two types of epithelia, either gastric or pancreatic. It's related to the persistence of the vitelline duct, or yolk sac. If it does contain heterotopic gastric or pancreatic tissue, this tissue can be active and produces normal products. This is the most common congenital anomaly. It can be asymptomatic, but can also cause bleeding, intussusception, volvulus, or obstruction. It can be diagnosed with a pertectinate study, or more commonly, a Meckel scan, which is more commonly referred to as a Meckel scan. A note from embryology is that while Meckel is a persistence of the vitelline duct, a different condition is an omphalomesenteric cyst, where the vitelline duct is abnormally dilated. Now we have intussusception and volvulus. Intussusception is when there's telescoping of a bowel segment into a distal bowel segment, which can compromise blood supply. This is more common in children with a potential viral etiology, and if it occurs in adults, it's generally from an intraluminal mass or tumor. This is a surgical emergency in kids. Look for the classic description of currant jelly or bright red stools. Whereas intussusception is telescoping, volvulus is a twisting of a portion of bowel around its mesentery, usually at the cecum or at the sigmoid colon, where there is redundant mesentery. Volvulus can cause obstruction or infarction and is most common in the elderly. Hirschsprung's disease is a congenital disorder caused by failure of neural crest cells to migrate into the distal colon. Megacolon develops because of the lack of ganglion cells that prevent the colon from relaxing to allow stool to pass. Babies have constipation and usually cannot pass meconium. Imaging shows a transition zone with dilated bowel proximal to the aganglionic segment. A related point is that risk for Hirschsprung's disease is increased in patients with Down syndrome. Now I've got a slide with a number of different intestinal disorders for you to be aware of. The first is duodenal atresia, which is another disorder associated with Down syndrome. This causes early bilious vomiting with proximal stomach distension due to failure of recanalization of the small bowel. There's a stereotypical double bubble appearance on imaging. With diseases like these, it's very important to keep track of whether or not the vomiting is bilious or not, because if you know that, you'll know if the patient's illness is proximal or distal to the duodenum and the insertion of the biliary system into the GI tract. In this case, the vomiting is bilious because the atresia tends to be in the distal duodenum. Meconium ileus is a common presenting sign of cystic fibrosis. What happens is that a meconium plug obstructs the intestine, thus preventing stool passage at birth. What gets overproduced in cystic fibrosis that might cause this plug? That's right, mucus. You probably learned this back in the biochemistry section when we talked about genetic disorders. Necrotizing enterocolitis, or NEC, is a major complication in neonates. There's necrosis of the intestinal mucosa and possible perforation. The colon is the most common site, but it can involve the entire GI tract. It's a very important disease to know, as it affects neonates who have decreased immune systems, and NEC is potentially life-threatening. The classic radiographic sign is pneumatosis coli, which means that there's gas in the bowel wall. Ischemic colitis here is of a chronic variety. It is, as the name suggests, inflammation of the colon from reduced blood supply. The pain develops after eating, and therefore patients eat less to avoid pain and end up losing weight. The most common locations are at the splenic flexure and the distal colon. Can you recall why this is the most common location? We talked about it before. Exactly. This is the watershed area between the region supplied by the superior mesenteric artery and the inferior mesenteric artery. It's more common in the elderly. Adhesions, which are a common result of surgery, are a frequent cause of bowel obstruction. They may have well demarcated necrotic zones. Lastly, we have angiodysplasia. This is where a tortuous dilation of vessels leads to bleeding. It's common in the cecum, terminal ileum, and the ascending colon. You generally see it in older patients, and you look for it by angiography.